sorry, you're at the end of the article, you suggest 3 preventative strategies, 3 ways to solve the mental health crisis, but
Right.
but they, I mean, they do seem to me to be wonderful strategies, and I wish that all governments in the world now listen to you explore them.
Listen up, governments.
So tell us them.
Right. So the 3 that I focus on here are intended, really, I think they're the ones that we get the biggest bang for our buck, to put it that way. They're not the only things that we could do, but I think they're the 3 things that would make a big difference and would clear up researchers, clinicians, and social workers and other people to tackle the other causes of mental health problems that can be really difficult to deal with. So the first one is universal basic income as a way to lift people out of poverty, to reduce inequality, to promote social interaction and community building. These were all the lack of those things. So having poverty, inequality, social isolation, and community disintegration were all the factors that social psychiatrists and psychiatric epidemiologists identified as being particularly harmful to mental health when these sort of topics were researched in earnest during the middle of the 20th century. So we've known this for a long time. We just haven't really done much. In fact, in many ways, like with austerity, we seem to be going in the opposite direction. So I think UBI, it might not be the perfect solution, but it's the best solution that I've seen to tackle these things, which are the core social determinants of mental illness. So that's number 1. The next one relates to what we were saying about food. So really taking what science is starting to tell us now and what history would have told us a lot longer before that about the relationship between food and mental health, and basically work at making good, healthy food affordable and getting rid of all the bad stuff. And by bad stuff, I would start with chemicals. And a lot of this, again, is these are socioeconomic interventions. The reason we have preservatives in food is to lower their cost. These are, if we're able to structure our lives a bit more around food and healthy food, then this would make a big impact, not only our physical health, but our mental health. And remember that physical health and mental health are, as one social psychiatrist put it in 1962, hopelessly intertwined. And I mean, that's absolutely true. If you're dealing with mental health problems, your physical health is going to suffer. Many people dealing with physical health problems suffer from mental illness as well as a result. So that's number 2. And then the final thing, again, relates to what you're saying about ecology, and that's access to nature. In various ways, and physical activity in nature. This is something that I think we all know intuitively, but during the pandemic in particular, people talked about how, when they were forced to go outside, because we weren't able to go outside. When we were able to go outside, we really enjoyed it. And we had that beautiful spring, and the birds were singing, and people just seemed to recognize all this beauty and wonder that was around them that most of the time we don't recognize because we're so busy with our lives. So if people were given more opportunity to engage with nature, and not just in kind of utilizing nature, but actually engaging with nature. One of my favorite things to do is eco-volunteering. So I go up into the Scottish hills and I plant trees and I root out invasive species.
That's what I do too. I do the same. I do the same.
And it's probably when I feel the happiest in a way, because it's enjoyable. It's nice physical activity, and it makes it feel like I'm doing my part, a little thing to make the world a better place. So, there's lessons in all these 3 things. And, if there was political will, we could do a lot on these 3 things. And I'm as convinced as I am about most things, that they would make a big difference in alleviating or in preventing mental illness, but also helping people already dealing with mental illness as well. In fact, on the last one, there's a really good podcast on the BBC. It is called, I think, Almanac for Anxiety. And the Helen Needham looks at five elements plus soil and how people engage with these things to deal with their mental health. It's brilliant. Each episode is only about 20 minutes, but I highly recommend it.